Hi, everyone. Thank you for joining us today on this virtual information session for our Doctor of Nursing Practice degree program here at University of San Francisco. My name is Tamara White, and I am the Graduate Enrollment Manager for the School of Nursing and Health Professions here at USF. I am usually the first point of contact for all new students who are interested in any master's as well as doctoral level programs. Our guest speakers today include Julie Maxworthy, who is the director of the DMP program, as well as chair-elect for the Healthcare Leadership and Innovations Department. She is joined alongside Alexa Curtis, who is the director of the DMP Nurse Practitioner programs, and she is the chair of the Department of Integrated Healthcare. And so now I'm going to pass it over to Julie Maxworthy.
So we're going to talk a little bit about the University of San Francisco, the history and purpose of the DNP, program goals, the different tracks and descriptions, kind of a little bit about what the final project is here at USF for the DNP portion, and admission requirements. And I have my assistant, Tamara White, to my right, and she is going to be letting me know if there's any questions that come up. So feel free to use the box that you will see at the bottom of the GoToWebinar for you to provide any kind of questions. All right, and here we go. So USF, School of Nursing and Health Professions, we were the first institution in California to offer the DNP advanced degree. I had the fortune of listening to Dean Karshmer back in 2006 at a ACNL meeting talking about the DNP. She had just come to USF as the new dean. She had been part of the process at the University of Southern Florida, also known as USF, to start the program and get it up and running. And when I went and listened to the presentation, I'd heard a little bit about the DNP, but when I listened to her speak, it was like, this is the degree for me. It had all the parts that I was looking for in a terminal degree. And I graduated in the first cohort back in 2008, and I have been teaching here full-time for the last 2 years. My time in service, my last clinical role was VP of Quality and Risk. I spent almost 20 years, though, in critical care. So again, with USF, we're the oldest university in San Francisco and the second oldest institution for higher learning in California. We have been granting degrees for over 150 years, and our programs are accredited by the Commission on Collegiate Nursing Education and CCNE and approved by the BRN. So USF, for those of you that have spent time in San Francisco, undoubtedly you have seen our advertisements throughout the city, and our mantra of change the world from here is one that really fits within the Jesuit traditions. And we take it very seriously that your activities that you do within your programs here at USF prepare you to make a difference. So our intent from the School of Nursing and Health Professions is to prepare health professionals who provide a moral compass to transform healthcare in order to promote equity and positively influence quality delivery and access to care. So we promote a higher standard and a passion for justice. And these are key pieces of the work that you'll be doing throughout your experience at USF. The mission of our School of Nursing and Health Professions is to advance nursing education within the context of the Jesuit tradition, focusing on diversity, social justice, leadership, and critical thinking. And these are key elements in the preparation that you will receive here at USF for your experience. So you're on the call because I'm hoping that you're seriously hoping on becoming in your DNP, or your Doctor of Nursing practice. And as you have probably read and learned about, the DNP is the highest practice degree any nurse can achieve. And it is one that requires advanced practice knowledge, but do not really see themselves as a researcher. And for myself, speaking from my own personal experience, I was looking for a degree that was clinical based. As I mentioned, my quality and patient safety background was one that I wanted to continue to pursue in my doctoral studies, and I did. And so that's the beauty. If you have a passion around an area that's related to practice. And again, like I said, quality and patient safety is in everything we do in healthcare, or it should be. That by your your project can really support that work that you want to do to give back to nursing, to have the opportunity to actually, really, at the end of the day, is a chance for you to give back and to develop a legacy for your experience as a nurse. And that is a wonderful opportunity for all of us in nursing to be able to give back to a profession that for speaking for myself, has given me far more than I ever expected. So DMP programs will prepare you with the highest level of scientific knowledge and practice expertise to assure the best quality of care and provide positive patient outcomes. So what that means related to the DNP, in essence, is if you look at the different essentials, which I believe we'll go through here in a few minutes, it's really looking at becoming a translationist. That's the best term I use when I describe what a DNP is. I'm a translationist. I understand how research is developed. I understand how to evaluate research for the quality and the strength of the research that's done. I also understand the culture in which this research could possibly be applied. Understanding the macro system in which this change needs to occur, and how the processes need to be standardized and put in place so that every patient receives the same care every single time. And that's what I mean by a macro system change of practice. But we take everything that all of our nursing research colleagues and our physician partners have put together, and we put together best practice, best evidence, and apply that to an environment in which we see there's an opportunity for improvement. And so for advanced practice nurses, it was proposed that starting in 2015, that this would be entry level for them. We still have a ways to go, but we are definitely making strides. I was at the last national DMP conference a few months ago, and there are almost 15,000 nurses in DMP programs across the U.S. PhD programs have been pretty consistent. There was a lot of concern when the DMP came on the scene that there would be a decrease in PhD programs, but that has not proven to be the case. There are still typically between 2,000 and 3,000 nurses in PhD programs at any given time. So there's been a huge increase in the DMP, and what that tells those of us at the national level is that there is a need amongst nurses to obtain this level of educational preparation to best prepare them for the future of nursing. So, as I mentioned earlier, the DNP Essentials. They are scientific underpinnings for practice. This is an area that we ensure that you understand, again, how to evaluate scientific research and the application it has for the bedside. As you probably also know, that it takes around 15 years for research to actually make it to the bedside, bench to bedside, and that has to change. And the DNP is a great educational preparation to make that change in healthcare. Organizational and systems leadership for quality improvement and systems thinking. We're looking at how you learn about yourself as a leader and how your leadership skills can best promote and advance nursing in your area of specialty. And again, we have nurses that are in our program that are educators. We have people that work for Genentech. We have nurses that work as and nurse practitioners that come back for completion or through our program through the BS and the DMP go to become FNPs and then do a project related to that as their DNP elements. There's so much opportunity. But again, at the end of the day, we're looking at systems thinking. How do we change practice so that we improve every patient that is touched, that has those particular needs in our system? Clinical scholarship and analytic methods for evidence-based practice. We do a lot of work with you related to evidence-based practice, looking at guidelines, looking at best practices in literature, and how best to pool that information to provide the optimal assessment of what the current state is, to provide you the backdrop by which you can analyze your current state and your particular environment and what the future state can be, and provide you the the infrastructure to make that change, to move your organization to this new place of knowledge. Information systems technology and patient care for the improvement and transformation of healthcare. There are courses that we have related to informatics, healthcare policy, those types of things, and how those classes prepare you to understand all the things that are going on in healthcare outside of your particular area, and that's the beauty of our program, is that we bring together nurses from all different areas of nursing, and together we learn from each other. I can speak as a professor here that I learn so much from my students every semester, because there are nurses that are coming to our programs that have such diverse backgrounds that I can just see that nursing is going to improve tremendously based on what's happening with the growth of the DNP. Again, healthcare policy, as I mentioned, we have a healthcare policy and ethics as well. I have a look at the law related to healthcare and where we're today in an affordable care as it's transforming healthcare, the benefits of that to nursing and to our patients and our clients throughout along the continuum, how incredibly important it is that we have nurses at the table, and nurses having a doctorate at the table is essential for us to continue to be the patient advocates that we are. Interprofessional collaboration for improving patient and population health outcomes. We are constantly looking at population health and how we can improve that, and in improving it, how we help patients along all the continuum, clients along all the continuum of health, wherever they are at that current time. We have nurses in our program that are in hospice, palliative care. We have people at the prenatal stage. I mean, we have cradle to grave as far as the continuum of healthcare expertise that comes into our program, where it's shared and growth occurs. It's your journey at the end of the day, and it should be perceived as that, because it's not easy. It's a lot of work, but at the end of the day, I have yet to find a student that didn't transform through the process. Clinical prevention of population health, improving the nation's health. And again, with healthcare reform, this is a prime time for you to come into this setting to make a difference. And advancing nursing practice, wherever that occurs. And that's an important distinction. I think we have to realize, I'm sure a lot of you know, how healthcare is moving from the acute care to the community, and how important it is that we are at the table and making a difference. And the DNP is the perfect solution to this. So the increasing demand for the DNP. As you know, every day with your inbox for your emails, there's more and more information that you're getting that you're having to make a decision about practice. And so that expansion of knowledge, how do you learn the tools by which you can prioritize what's good and what has not so good, and what should be applied to your particular situation. Concerns about the quality of patient care and patient safety. Those concepts of patient safety is woven throughout our curriculum. It is the essential piece to us making a difference, is keeping the patient at the center. There has been a shortage of doctorally prepared nursing faculty. Here at USF, we have a wonderful mix of doctorates of education. We have doctorates of philosophy and doctorates of nursing practice, all teaching in this. We also just recently also have a medical doctor who has joined our ranks as faculty here at USF. So we have such an array of expertise to help you on your journey. But with that, we do know that there's even more of a demand. And again, as I mentioned earlier, for us to be part of the solution, we need to come well-armed in our educational preparation. Increasing educational expectations for preparation of other health professionals. As you well know, our pharmacists are now entry-level into practice, is at the doctoral level, and physical therapy also is striving to have the entry level into practice be a doctorate. And those both are clinical doctorates, as the doctor of nursing practice is. Relation between higher levels of nursing education and improved patient outcomes. That has been researched thoroughly, and time again it comes back that the higher level of the education of the provider, the better outcomes there are for our patients. Alternative to the research-focused PhD, the best combination in any situation is to have a PhD and a DMP working together, because the research preparation that our PhDs have, it makes an incredible opportunity for us to work together to identify where there's gaps, work with our PhD partners to develop and do the research related to a particular area, and then use DMPs to assist at the microsystem level to change practice. Increased complexity of patient care, and expert practitioners who can also serve as nursing faculty. I will tell you here at USF, the DMP is highly regarded to the effect that our positions that a lot of us hold are tenure earning. So, and that's, I think, a very important distinction that we have here at USF. So, any questions at this point? We're good. Okay. Program details for core DMP courses. Just to kind of give you sort of how we work. So I use the word core DNP. So there's courses that we have depending on where you're coming in as a BSN DNP or an MSN DNP. The beauty of us being a School of Nursing and Health Professions, we have a tremendous opportunity to provide you with several ways to get your DNP. There are several routes. It's full. You can do it full-time, part-time. There's a blended model. There's online and on-campus. We are working, and the on-campus is for the DNP core courses are here at the Hilltop. Several of you that might be interested in our program are BSN, and there's lots of different trajectories for you to get to this point. There is, we have an MPH option, we have a clinical Master's of Public Health, we have a CNL or Clinical Nurse Leader option, we have a Master's of Behavioral Health option, we have a Master's of Informatics option, we have a Master's of Healthcare Simulation option. All those are Master's programs that we have that would allow you to get a Master's in an area and then do a DMP completion. The curriculum patterns for those are all a little different. And when you enter our school, we meet with you and we figure out, based on what your needs and wishes are for your experience, we will provide you the patterns that will provide you that opportunity to meet your expectations. As it says here, we have an online option for core DMP courses. We have applied to offer that through our accrediting body, and we're very hopeful that that will be come to pass, and we'll be able to start courses, core courses for the DNP online during our next academic school year. Our teaching weekends, our classes currently are held 2 weekends a month, and our classes for the core DNP courses are Friday night, 5 to 9, Saturday 8 to 12, and also then Saturday 1 to 5. So Alexa, who's on the call, will be going through some of the FNP aspects of it, or the nurse practitioner aspects, because we have several options for the NP. She'll go through that because that has a different pattern, so to speak. And when I use pattern, I mean the courses that you need to take to allow you to be to graduate. So there's a pattern of courses, different courses you have to take to complete. So those are the core DNP course, kind of a quick overview. But again, ideally, full-time is what a lot of students do, but the part-time, and sometimes if you come in going full-time and life happens, as it often does, you have an advisor that's assigned to you at the very beginning of the program, and together you will figure out what's best for you at that particular time to make sure that you can get what you need done life-wise and school-wise and keep moving forward, because that's the key, is to keep moving forward. The different tracks, there's a healthcare system leader, a family nurse practitioner, a psych mental health nurse practitioner, a DNP completion, and an executive leadership DNP. So the healthcare system leader is really, it's coursework that has an additional elements related to finance and healthcare innovation, a lot of it focusing on where healthcare is going to, so that you are well prepared for the healthcare of the future. Well, it's actually happening now, but it's as it's been for many years. It's never changing, but it seems to be changing at a much faster rate than it ever has. So it's an opportunity for you exposure to different perspectives, theory and research, critical understanding of professional practice issues. So this is just a focus for people that are interested in perhaps pursuing more administrative roles in their environment. And it provides you with those foundational pieces that oftentimes in our undergrad or even our graduate studies may not have provided the full extent that was needed for this new path that you might be interested in pursuing. And Alexa, you want to take over for the family nurse practitioner arm?
Sure. Thanks, Julie. And thanks to everyone on the call. Really appreciate having you on the call today. Again, I'm Alexa Curtis. I'm the Director of Nurse Practitioner Programs at the University of San Francisco. My doctoral preparation is PhD, so I can definitely speak to the symbiosis of PhD and DNP faculty working together in the clinical environment. I think the DMP is a great degree. Many of you probably have heard of the 2015 mandate of requiring all nurse practitioners to be doctorally prepared. Well, obviously, that 2015 mandate didn't come to fruition. And I will admit, when I first heard the 2015 mandate for doctoral preparation for nurse practitioners, I was a skeptic. But having been to the national meetings over the last few years for the nurse practitioner faculty and nurse practitioner leadership, I am more and more convinced that that mandate is on its way. So if you are a prospective student interested in becoming a FNP, or you are a FNP considering a DNP, it really, you are moving the direction that the profession is moving. So the nurse practitioner, if you're on this line, I'm sure you're well aware of what actually a nurse practitioner is. In our nurse practitioner programs, we educate and train future community-based providers. Our focus is on community-based healthcare, not acute care healthcare. Now, that's not to say that if you graduate from our program, there is nothing that bars you from becoming an acute care nurse practitioner. In fact, one of our graduates this upcoming summer, she already has a job offer waiting for her at Stanford to become part of the HEMONC team. She's a well-established HEMONC nurse. We've been able to adapt some of her clinical experiences while meeting the objectives of the FNP curriculum, also to have her engage with palliative care and HEMONC at Stanford, and they are just waiting for her to graduate. So you can certainly move into acute care if that's a place where you already are, or if down the line you decide you want to become an acute care nurse practitioner, you certainly can become one with the preparation you receive at USF. There are also transition programs that help community-based nurse practitioners move into acute care if that's what they desire. You can go ahead and switch slides. Okay, so we have several different options at USF. One is the psychiatric mental health nurse practitioner. So what this is, obviously, is a nurse practitioner who's focused on psychiatric and mental health. How does that make it different from the other family nurse practitioner tracks? In the psychiatric mental health nurse practitioner track, the student has classes that they share classes with the FNP students, including pharm and pathophys and the health promotion class. But then they verge off and take classes that are specific to psych mental health. They share many of their classes in psych mental health with our PsyD students, our psychologist doctorate students. And what makes a psych mental health nurse practitioner degree different from a family nurse practitioner who might be doing psych mental health? Like in my practice, I would say 30% plus. 30% is a very conservative number. 30% of my patients have psychiatric issues or comorbidities that I care for in the primary care setting. Nothing in my FNP degree bars me from providing those kind of services, but I am certainly the first to tell you that I am not psych mental health trained. specifically. If you are a psych mental health NP, you also take the therapeutic counseling courses. You are required to sit for certification. You need to have these specialized courses where you learn to do the psychiatric counseling type of therapy, and those are the classes that the FNP students don't take. So I hope that makes sense. What's different about psych mental health NP is that when you graduate, become certified, and become employed, you can also do that therapeutic counseling end that I am not certified to do as a family nurse practitioner. Okay, go ahead.
All right, so the DMP completion. So this is for the individual who already has a master's degree, who is seeking professional advancement in the field of healthcare leadership. So this individual, we have quite a few current FNPs that sign up for this coursework in light of these new expectations, anticipating that there's going to be an expectation that FNPs are doctorally prepared. And there is an option, as you can see at the bottom of the slide, for family nurse practitioner certificate or psych mental health nurse practitioner certificate as well, for those people who come in with a master's already. But it integrates the coursework with nursing, informatics, health policy, evidence-based practice, project management, all kinds of courses that will provide you the foundation that you need at the doctoral level to be successful. The DNP, or the Executive Leadership DMP, it came about with the expectation that a lot of nurse executives really need to be doctorally prepared, to have a seat at the table. And so this particular program is really for the nurse executive at the director or higher level in an organization that really wants to revisit their skill sets, increase their knowledge related to changes that are happening in healthcare. And it's a cohort model. All of the other other tracks that we've described are not based as a cohort. A lot of people end up becoming sort of a cohort of sorts because they take all the courses, a lot of the courses at the same pace, but that's not the expectation. The DNP is definitely a cohort model, and it's been very, very successful. So, people travel to San Francisco 11 intensive weekends during the 6 semesters. So it's 6 semesters, but really it's a 3-year program done in 2 years because we go year round. We have individuals come, it's kind of, as our dean likes to call it, the San Francisco Advantage. Our students stay at a hotel in downtown San Francisco. They meet, like I said, usually twice a semester. We do a lot of things online as well, but it's a cohort model. And we've had students as far as Saudi Arabia participate in this program. It was one of the very first ones that was launched for this particular group of individuals with a skill set that is very strong, but they still realize that there's an opportunity for personal growth. So, about our program, as far as one of the things people ask about the practicum, the clinical experience. So there's an expectation that you will have 1,000 hours. Now, if you come in with a master's, we review that, and we will give you credit for those hours that you've taken in other coursework. Now, if you have as many people who come into our program that are already nurse practitioners, they come in with a significant amount of hours because that's how their coursework plays out, as to be expected. And what happens in those particular situations, we have an expectation that they will do a minimum of 500 doctoral level practicum clinical hours of experience during our program. So here you'll see the completion time. It's 2 years, and as I mentioned before, for the DNP, and all our programs are year-round. And so it gives you the opportunity for us to see you throughout the school year and then during the summer as well. So that's why we say it's 6 or 7 semesters and you do it in 2 to 2.5 years oftentimes. The FNP, as you can see there, or the PMHNP can take you 3 years. And then the BSN to DNP takes roughly 4 years. And that also, those credits that you see there are also based on the number of practicum that you need to take and what you end up deciding to do as far as your track is concerned as well. All right, so a lot of people ask us also, what is the evidence-based change of practice project? What is that about? And it's really an application at the macro system level to demonstrate your clinical and scholarly expertise. So you do a practice-related project to affect change or improve outcomes in a clinical setting. Now, clinical can be many things. Again, as I mentioned earlier, we've had students that work in pharmaceuticals. We have students that work in clinical research. We have students that do. There are school nurses. I mean, we have our settings are as varied as nurses are. So what you will do is you will work with your chair to determine what in your particular environment will work best. And oftentimes I always tell my students, what keeps you up at night? What are the things that are happening in your environment that you would like to see changed? See changed so that every time this event happens, there's a process that will be utilized to ensure consistency across your system. Now, your system may be a clinic, your system may be a whole health system. But it's that change of practice that we want to see that's done. There's a couple of steps to it. We have a quals period, which is usually 3rd or 4th semester, depending on what you come in with. I'm speaking right now of a master's prepared individual coming into our program. That's usually semester 3 or 4, where you come and you decide what your project is going to be. You develop a prospectus, and then we also have you write a manuscript that you also will submit for potential publication. So if you've ever wanted to write, this is a great program because this is part of our expectations that you put together a manuscript and actually submit it for publication. For you to move through the program, it's not expected that it gets published, but you go through the process of doing this work. Because at the end of the day, we want you to learn how to do this so you can repeat the process after you leave us. Just as our PhD partners do, they learn how to develop research. They learn how to put a study together, how to develop, how the power of the study needs to be to make sure that you have, all the elements so that it actually is a valid study. All those types of things our research partners have learned, and they provide that expertise moving forward after they've graduated with their PhDs so they can replicate what they've done in school in other environments. It is no different with the DNP. You are learning how to put a large change of practice project together, implement it, and evaluate it, which can be, it's very challenging, but very satisfying for those individuals who have been able to make huge changes. I have to say, our students, through their experience of coming back to school, because it should be your experience, because it should be something that you really want to do and see the value of, because it's a lot of time. And you hopefully come in with something that you're passionate about, and we can help you through your journey to make it a reality, have that change become a reality for your environment. And it's amazing to see how much growth people have. We've had graduates as old as 70 in our program, because they as nurses have been nurses for 50 years and have decided they want to give back in a different way, and they have a new phase of their life that they want to pursue, and they see the DNP as a method by which to do that. And it's their opportunity for themselves. And so that's a very important piece of all this, is that this should be something that you truly want to do, because it's something at the end of the day you should be very proud of. Some of the projects that I have listed here are just some of the things that people have done. It's just amazing. I mean, you can go, if you happen to, well, it's actually, I believe, this part of the Virginia Henderson Library through the Sigma Theta Tau International, actually you can view lots of DMP projects. So there's such an array of DMP projects that people have done. that give you the and if you're interested in kind of what the final project will be, we can provide those to you if you're interested for our students. Admission requirements, the reviews are done by a team. After you submit, we review them and make a determination of your eligibility to be in our program. There's recommended a GPA of at least 3.0, 3 letters of recommendation, documentation of an RN license. We ask for a statement of professional goals. And this is a very important piece of the equation for us. We want to see that you have good writing skills, that you have a passion about going back to school and kind of where you see your career going related to this degree. So we read that very carefully. It's a very important piece of all this. Your resume, transcripts, and there's an application. And as you can see at the bottom of the slide, because for the fall, it's May 15th, which is coming here sooner than we know, because April 1st is on Wednesday, and spring term, which is January, is October 15th. Just to let you know, I believe that for the FNP program, they're currently accepting students in the fall, and we have some students that apply for the spring, but those are only the MSN students. BSN to DNP are only in the fall. So in the spring, it's only the completion DNPs that we take applications for. Cost, which is always an issue for every student. Tuition is $1,245 per unit. There are loans that you can get. We have lots of resources here at USF to assist in your pursuing of this and of your degree with the least amount of financial burden. So there's loans, Grad Plus loans, there's all types of opportunities that we have within USF that we can connect you to.
Can I ask, Tamara, can you scooch back to the FNP slides, because there was some information that I was expecting to see that I might have missed.
Of course, that one.
That I wanted to go over. Okay, so Julie talked about the different tracks of the DNP projects, and I wanted to emphasize this for we went over the psych mental health NP track pretty thoroughly, but that we have 3 different tracks currently for the family nurse practitioner BSN to DNP. I'm addressing BSN to DNP specifically now. Julie had mentioned that we have the behavioral health and the Masters of Public Health and the clinical nurse leader track. So what that looks like for a family nurse practitioner, BSN to DNP, if you come in and you are very clinically situated, you are working in a clinical environment that you think you may want to stay in, the CNL track might be your best option. That would be something like my student who's at Stanford, staying at Stanford, can organize a practice change project around her current employment at Stanford. That might be the best fit for that student. Students who might be interested in the MPH to DNP, family nurse practitioner track, these are students who have a specific interest in population health. And if you, our program is very population health oriented. If you read the Healthy People 2020 objectives, you will see that increasing the population health education within nurse practitioner programs is a national objective set out by the government. There's a huge emphasis on population health now across all organizations. Coming out of a program with an MPH, FMP is a really hot degree. So the focus is, obviously for the MPH folks, is population health. The Master's of Science Behavioral Health track, this is for somebody. I actually developed this curriculum track around what I would want to do if I went back to school. Actually, I want an MPH as well. But in terms of the real practice that I do on a day-to-day basis, where do I feel like the biggest hole in my education is? And that is in psych mental health. Because as I said, as a family nurse practitioner, educated and trained in providing primary care in the community setting, we are seeing the bulk of the mental health that walks in, not so much the treatment of the complex schizophrenic, although we do manage schizophrenics, but I wouldn't do the first line management of schizophrenic, but first line management of depression and of anxiety and of bipolar, and then certainly all those comorbidities that we're dealing with, you know, people and their hypertension and their bipolar, and what do we do? And I can tell you, my peers, that's the area where we feel most inadequately prepared to serve the public. So what we did with that degree is we took the Master's of Science in Behavioral Health that we already had, and then we adapted it for a clinician. So it's not the same degree as our non-clinicians. Our nurses come in and take different courses. So it's a combination of behavioral health courses and PsyD courses. And I will tell you that I have received phone calls from organizations looking for nurse practitioners with a behavioral health background. So that's a really great degree. And I will take questions later. I'm sure you'll have a lot of questions on those curriculum tracks. And if you email me, I am more than happy to send you an example of what those curriculum tracks would look like. A couple other things that I wanted to talk about that I didn't see come up on, actually go to the DMP Combination. That's a great place to stay. Go to the DMP, there we go. If you're coming in as a master's prepared person and looking at, you already have your master's and you want to become a nurse practitioner, we do offer some transfer credits for your previous master's level work, and that's decided on an individual basis by looking at your previous coursework and how it meets the course objectives of our DNP, our FMP DMP completion. So, and one of our criteria is those courses must be completed within the last 5 years. So if you have previous graduate work within the last 5 years, you will work with your advisor to see if there are any appropriate transfer credits that can be had from your previous work. Another thing that we didn't really talk about, well, one thing I want to say about our nurse practitioner program is we have so far have a 100% certification pass rate. So, you know, that's a really strong testimony to the quality of the didactic education you get within USF. Students often have questions about what's going to happen with my clinical placement, and that's a really important question to ask when you are looking at nurse practitioner programs. It is, you want to know when you are shopping for nurse practitioner programs what kind of assistance you will have in obtaining your clinical placements. At USF, we understand very clearly that it is our obligation to provide you with the clinical placements that will allow you to meet your course objectives. Now, that being said, we are limited, like every other program, in opportunities. So, we might not be able to provide you one specific site or one specific location or one exact type of interprofessional opportunity. But our obligation is to make sure that you have the opportunity to do 100 pediatric hours, 100 reproductive health hours, 100 geriatric hours, and then the rest of the required 500 for direct patient care hours for nurse practitioners in adult care. It is our obligation to you that we make sure those opportunities are available. However, we also very much value our partnerships with students, and the best clinical placement is a clinical placement that is meeting the future career goals of the student. I would say 50% of our students come to us and say, I want to work in Modesto, and I want to work at, I'm interested in working at this federally qualified health center, and I have a contact. Do you think you can help me make that work? And we love that because it's meeting the needs of the students. And many of our students, I would say, just off the top of my head, 5 of our graduating students are in those types of placements where they had connections, they had a community they wanted to work with. They did all 4 semesters of direct patient care work in that one facility, and those facilities are just waiting for them to graduate so that they can be hired. In terms of classes, as Julie already mentioned, the FMP classes have different expectations slightly than the DNP. The FMP clinical classes, courses with a clinical focus, are held on Fridays. So if you're in the FMP curriculum or FMP curriculum, you can expect to have classes all day Fridays, not just Friday evening. Once you get into your clinical coursework, you will in addition have 1 day a week where you're in a clinical setting. So just know once you get into the clinical coursework at FMP, the schedule gets pretty tight, and you need to make adjustments in terms of your work schedule and your family schedule for the expectations of the program. And I think the last thing I had was in terms of the application. Julie already went over the application, and I will tell you in reviewing NP applications what I look for. GPA is important, but it's pretty relative. Depends on where you were developmentally. If you were an undergrad, if you were a classic 19-year-old undergraduate and had not your best GPA, we pretty much understand what it means to be 19, okay? So we can look at the trajectory of what a GPA looks like. Maybe you went from there to a master's degree and did better, or maybe you have other opportunities to show your ability other than that GPA. So we definitely weight GPA, but I particularly look strongly at your recommendations. And I am looking for who those recommendations came from, and certainly what those recommendations say. But you can imagine when you evaluate recommendations, they're generally positive because they are solicited by the students, right? But it's meaningful to me who they come from. So if you are a BSN to DNP, someone who's coming pretty quickly out of your baccalaureate, provide a recommendation from your previous academic environment. I want to see what your instructors thought about your work. If you are currently working in a clinical setting, provide me with a recommendation from your immediate supervisor. Those are the kind of recommendations that are meaningful to me. And then your purpose statement is very meaningful. We're looking very closely as to how it's constructed because the DNP has a very heavy writing component, and I want to see that you have the ability to be successful in terms of writing. And at a graduate level, this is not a PhD in English composition. At the graduate level, the expectation is that you can put together a publishable document, but that doesn't mean if writing isn't your best thing, nursing is probably your best thing, right? But maybe not writing. At a graduate level, hiring an editor is fair game. So if you struggle with writing, if perhaps you have multiple languages and English composition isn't your strongest suit, so hire someone or have a peer review it because we are looking to see if you understand the expectations of graduate level writing. And then the other thing I'm looking for when we review those is, do they understand the program that they are applying for? So this community-based program, options or psych mental health, all the other curriculum tracks we have, and do they understand USF? Have you been thoughtful about looking at the mission of USF and what it means to have a Jesuit education? So those are the things I'm looking for, and I am happy to answer any questions.
So thank you, Alexa. That's great. We've got about 10 minutes. We've got quite a few questions, and I think between the two of us, I think most of them could be easily answered. So the first one is, I would like to at some point be involved in research, but I want to still have a large impact in the clinical practice. Is this a good place to start? And the other question kind of related to that is, does a DMP degree preclude the DMP from doing research related to the practice specialty? So you are involved in research in the DMP in the sense that you are reading what's currently out there in the evidence, and you are making a determination on the quality and the strength. We help you learn those skills. You are doing a change of practice, and how you differentiate kind of what we do and what you would get in a research doctorate is we look at things in an aggregate. When you do quality performance improvement, you're really looking at an intervention based on the culture that you're trying to make the change in. Research doesn't typically have the cultural aspect of it, and that's a huge part of your success in your DNP macro system change of practice. So yes, we do use research, but we do our change of practice, and our goal is really for you to make a change at the macro system level. So Alexa, do you have anything to add to that?
Yeah. Yeah, absolutely. And as a PhD, what I can say is that in the DMP degree, you are not trained in methodology. So most of my training was in methodology. Most of your training is in how to manage a project, in the leadership and the finance. So absolutely agree that the role of the DMP in research is to, one, know how to evaluate and synthesize the literature, and number two, how to work in a research team. So if you finished a DMP and you wanted to work in research, the next logical step would be to develop a research team that includes a methodologist, and that makes an extremely strong research team. The other step is I have many peers who have completed a DNP and then have decided to also later on take their DMP project and complete a PhD for the methodology end.
Thank you. So there's a question here about the difference between the DNP Healthcare System Leadership and the Executive Nurse Leadership DNP program. And I will let you know that the difference is, one, as I mentioned before, executive leadership is a cohort-based, and the position that you need to be in as far as your career trajectory is have to be director or higher. That is not the criteria that we put forth for the healthcare system leadership track. So hopefully that helps you differentiate. And like I said, the cohort model meets in a hotel in downtown San Francisco. What we kind of call the traditional, which is it's more self-paced and what have you, is up here at the hilltop. So hopefully that helps answer those questions. So there's another question about nurse practitioners, primarily mental health. Is it outpatient, inpatient? How does distance clinicals come to be, or does it have to be in San Francisco? And the other question related to this is, when do clinicals start for the FNP program? So Alexa, do you want to answer those couple of questions?
Sure. So the Psych Mental Health NP program, the majority of the focus of the clinical training is in the community-based setting rather than the inpatient setting. However, we do have inpatient opportunities, and actually the physician that we just hired to join our faculty is a psychiatrist and does some of the mentorship and works in inpatient psych as well as outpatient psych and does take students. So that would be the answer to that one. What was the other?
When the clinical start in the FNP program. The other thing you might want to mention about our physician who's joined our faculty, he's also a nurse.
Right. He's an MD RN who's actually finishing a DNP project. So distance learning. There was a question about distance learning. We have our distant clinicals. We have students from all over. Currently in this cohort, we have three students who are doing their clinicals in LA. In the SoCal region. My obligation is to find clinical placements within a 200-mile radius of USF. I don't necessarily have an obligation to be able to find students' clinical placements in SoCal or out of state, which sometimes state by state, some states have rules against it. We can do some out of state placements, but if you are looking to be outside of my 200-mile radius of USF, we can generally make that happen, like we did for the 3 in SoCal. But we might need to rely on your connections to do that. And then we do visits to all our clinical sites. So if you're going to be working in Wisconsin, we might have to be a little bit more creative about how we do our clinical visits. Sometimes we can do that electronically. The clinical work in the NP program, if you are a BSN to DNP, your clinical work, I'm looking at pattern right now, begins approximately in the 8th semester. And then if you are an MSN student coming in with an MSN, your clinical work begins in the 4th semester. Let me know if you have any more questions on that.
Excellent, thanks. Another question was, can I work full-time while attending USF? And the answer I can say personally is yes. Because that's how I did it. And most of the students here, that's what they do. Depending on what route you take, there may be, most of our courses for the other tracks are in the evening. So it's very much based on the working student. One other thing I wanted to bring up was class size. Class size varies, but typically for our DMP courses, it's less than 20 per course. So let's see. Somebody has, yes, absolutely. Absolutely. Go ahead.
So from the FMP perspective, yes, we do develop our program around the working professional. We really do believe that what we're doing as an FMP program is building on. You are already expert nurses, and that's what differentiates. I have a lot of PA peers that I love and respect, but that is what differentiates a nurse practitioner from a PA beginning, a novice NP, is that we are building on your current clinical experience. However, you just need to know your own life. If you've got a lot of other commitments in your life and you're working full time, once you get into that clinical track where you're doing 1 day a week in the clinical setting, you're probably going to have to start thinking about moving some things around.
Excellent point. Thank you. So somebody asked here about the amount of RN NP experience, if any, an applicant needs to have before starting the DNP program. And I believe Dr. Curtis kind of answered that question already. The most important thing for you to do is to apply and have it reviewed.
And I like to answer it directly. Sure. We believe in growing them young. Personally, I rolled straight from my baccalaureate into my NP, and this was in 1987. I graduated in 1987. So there is no prejudice against a student who is coming straight from their undergraduate.
Right. Somebody asked about healthcare analytics to determine opportunities for quality and also design strategy. Absolutely. We look at big data. We figure out ways to, slice and dice it to help us with the current state. So all those types of things that, if that's what you're looking for through informatics and health policy and what have you, we look at big data, and there is great opportunity in healthcare. It's just the sky's the limit, depending on what your area of interest, passion, we'll help guide you there. If you're interested in health policy from a statewide level, we have connections at the state level for opportunities, and we're here just to help you be successful. And we have about a minute left. I'm thinking we'll probably wrap it up. I first of all want to thank you all for taking your time out of your busy day to listen to this webinar. And Dr. Curtis, do you have any last words?
Yes, if for any of the FMP applicants, feel free to contact me directly. My email is acurtis@usfca.edu. And you can also find that on the USF website. I'm happy to send you any curriculum patterns or answer any specific questions you may have.
Right, and what I've brought up here on the screen right now are the admission team contact is nursing@usfca.edu, and my direct email, if you'd like to continue a conversation, is jcmaxworthy, maxworthy, @usfca.edu. And again, I very much appreciate your time and attention and look forward to working with you in the future. Have a great day.